Hi, I'm Nick,
And I'm Amber.
and together we are Functional Movement Therapy. We are both doctors of physical therapy, and we're coming to you today to talk about patellofemoral pain syndrome.
Yep, and basically this is defined as pain around the kneecap or patella or even underneath the cartilage. We see a lot of patients that come into the clinic with this diagnosis.
Huge.
So, if this sounds like something you're interested in or something you may be struggling with, please continue to watch us and hopefully we can help you out.
And don't forget to hit subscribe below.
Okay, so Nick, give us a little bit of a definition or explain to everyone what patellofemoral pain syndrome is.
So, patellofemoral pain syndrome is characterized by pain around the knee and under the kneecap. And we typically see this in the younger population, those who play and participate in dynamic, really explosive sports like basketball players, volleyball players, a lot of runners. And they're going to see a regression in their ability to complete those explosive components like jumping and landing and cutting, those types of activities.
Yeah, so due to these repetitive stresses, once the knee itself gets inflamed, then we also start seeing issues with just stair negotiation, squatting, lunging. Things you do on a daily basis, even
Right.
prolonged sitting. Like people will say, it will bother me to sit in class because that knee is already inflamed and you're keeping it in a bent position. It's going to aggravate it.
Exactly. So, impairments that we typically see are people with poor hip strength, poor quad strength, tight muscles like the hip flexor and the hamstring, increase or decrease patella mobility. That kneecap is supposed to move in various directions, and if it gets stuck along the way, or if it's just floating because there's too much swelling around that injury.
Yeah, and don't forget, females are more likely to actually have this than males just because of the increased angle of our hips. It puts more stress on our knees, especially if we have, poor muscle coordination and control during these sports. And even improper footwear.
Right,
You'll never
right, don't
believe
forget
it,
that.
but some people come in with fallen arches, and again, where's all that stress going to be placed on the knee?
Mm-hmm.
So it's an issue all around. Poor mechanics at the hip and the foot can lead to issues at the knee.
Yep. So we're going to help you check yourself and start to work on some of these weak muscles.
Okay, so now we are going to give you guys a few interventions that you can do at home to hopefully help this knee pain that you're having. So Nick, what kind of things can we give the viewers at home?
We'll give the viewers what they want. The first thing you got to do is get rid of the pain, right? And that is really correlated with regaining your full range of motion. So one of the easiest and most often used knee interventions that we use in the clinic is a heel slide. And what you're going to do is actually help that knee range of motion along. If you're laying on your back and you just bend your knee up and back like you would, Amber, that's typically going to be painful. But we borrowed our trusty dog leash here. You wrap that around the foot, and then I give that a little crisscross there around that knee.
You
That
can
kind
even use a towel if you don't have a dog, or you can use a belt. There's lots
bed
of things you can
sheet.
do for
Yeah,
this.
anything will do. Don't go out and buy anything. But you're going to help with your hands to slide that foot all the way out, and then you're going to come all the way up to a comfortable position. Don't go to pain. Go to stretch, okay?
So say I'm hurting right here, you would recommend that I stop. I'm not going to push it.
Right.
Okay.
It's not no pain, no gain. It's no pain, all gain, okay? And if your yoga mat is really starting to create some friction there, then use
Yeah,
something
it's a little
like
bumpy. I think we would need a pillowcase or something.
or just use the floor, right? If we do something like that and bring you up there, I know that's not but it just slides so much easier. So we want to make this, not a resistance exercise.
Okay,
Okay.
so now my range of motion is full in my knee. So if and again, you don't want to go to the next step until you are pain-free with your full range of motion, full extension and full bending of the knee.
Right.
So what do we want to do next?
So we mentioned a little bit ago about tight hip flexors for this activity. So one of the things we want to do is kind of roll in that now full range of motion into a hip flexor stretch. And there's a couple different ways to do this, but to really identify some of the tension in the quads and the psoas at the same time, I like a sideline quad stretch. And you don't see this very often, but what you're going to do here is stabilize your trunk, grab the ankle, but I don't want you to just bring the heel towards your buttock. What I actually want you to do is to drive your hip forward and pull your heel back towards that wall, keeping everything in line. So the heel, the knee, the hip, all in line. And you're going to feel a nice stretch right through the front of the quad and hip.
Oh, yeah.
And it doesn't take long. We're going to hold that for about 20 or 30 seconds.
And this is my involved side, correct?
Correct.
This is the side that's hurting
Yeah,
me.
that's your painful side.
Okay.
You can just release that at your hand. Come on out and we'll work on that knee extension, squeezing that quadricep, and then coming on back and doing 3 to 5 sets of that. So it's a nice way. It's a really good warm-up once you get back to activity as well, making sure that the muscles are ready to go for action.
Okay, perfect. So now we have the flexibility of our knee back. We've stretched out some muscles. We're all warmed up.
And most importantly, your pain is down.
Pain's down. So now we want to strengthen so these issues don't continue.
Right. So what are your favorite strengthening exercises, Amber?
So one of my favorites is actually on your side. So we really want to try to strengthen that glute muscle back in your buttocks.
Yeah.
Because we talked about with poor hip strength, where is all that stress and tension going to go? To your knees.
Right.
Okay, so we really need to strengthen that. One of the easiest ways to do this, I like. So we're going to get down again on our side, same position. You can bend your bottom knee just to get a base and to stabilize yourself. Your top leg is going to be straight. Okay, you actually want to extend the hip back. So I'm extending it back toward the wall a little bit, okay? Now, before I lift this, I'm squeezing my butt muscle to engage the muscle first, and then lifting straight up.
Perfect.
And down.
Now, one of the things that we see pretty often is people start to lift from the lower back here, or they lift from the lateral thigh. So if you're feeling your tension, that these two are the movers, you're missing your primary target muscle right here on the side of the hip. If you put your hand in your back pocket, that's where your muscle should be, right? And so adding in some core stabilization, drawing in the belly button, there you go, it doesn't need to be very high. And you're making sure that pelvis stays really, really steady as you do that. Not that the pelvis is lifting back or the torso is twisting, right? All this from here up is staying very static. And you've got your quad and your hip, your gluteus medius activated, and that's your lift. You don't go really more than about 30 degrees, would you say, Ann?
Yeah, and trust me, you will get tired after 10 of these. You will feel it burning, so that's how you know it's working. But burning is different than pain.
Right. Obviously
keep
not
that in
pain in
mind.
the kneecap. Great.
All right, so if you have any questions on any of these, there's a lot more phases that we can give you guys. If you are past the inflammatory phase and you actually just want to get back to your sport, learn the right angles for jumping and squatting,
Right.
come see us at the website,
Yeah.
which is
functionalmovementtherapy.com. You join us on our Facebook page and absolutely continue to hit subscribe and ask us any questions below. We'd love to hear from you. Thanks. Have a great day.